The core legal principle here is that you do not lose your constitutional rights just because you lose consciousness. Your right to privacy and bodily integrity remains intact. The problem is execution. How do you exercise your right to refuse treatment when you cannot speak? Someone must speak for you, but who? And what criteria should they use? Should they say what asterisk they asterisk want for you, or what asterisk you asterisk would have wanted for yourself? Before 1976, this was a gray area left to doctors. Then came Karen Ann Quinlan. In 1975, 21-year-old Karen Ann Quinlan fell into a coma after consuming alcohol and Valium at a party. She suffered severe brain damage and entered a persistent vegetative state, PVS. She was awake. Her eyes were open, but she was unaware of her environment. She was kept alive by a ventilator. After months of no improvement, her parents, Joseph and Julia Quinlan, devout Catholics, consulted their priest. They decided that keeping her on the machine was extraordinary means and morally optional. They asked the doctors to turn off the ventilator and let her pass. The doctors refused. The doctors didn't refuse because they were cruel. They refused because they were terrified. In 1975, disconnecting a ventilator from a living body looked a lot like homicide to a prosecutor. They forced the parents to go to court. The New Jersey Supreme Court issued a historic ruling. They stated that Karen's right to privacy allowed her to refuse treatment, and since she was incompetent, that right could be exercised on her behalf by her guardian, her father. The court effectively said the state has no interest in forcing the prolongation of a vegetative life. Crucially, the court suggested that hospitals create ethics committees to handle these cases internally so families wouldn't have to endure the trauma of a trial. This ruling birthed the modern hospital ethics committee. Fast forward to 1990, Nancy Cruzan was a young woman thrown from her car in a wreck. She ended up in a PVS. Unlike Quinlan, she could breathe on her own. She was kept alive by a feeding tube, artificial nutrition and hydration. Her parents wanted the tube removed, arguing Nancy would not want to live like a vegetable. The state of Missouri intervened. They argued two things. First, that food and water are basic care, not medical treatment. Second, that without a written, living will, the parents' word wasn't enough. They demanded clear and convincing evidence of Nancy's wishes. The case went to the U.S. Supreme Court. It was the first time the High Court addressed the right to die. The court ruled two things. First, they affirmed that a feeding tube asterisk is asterisk medical treatment, just like a ventilator or dialysis, and therefore can be refused. This was a huge victory for bioethics. But second, they ruled that a state has the right to demand clear and convincing evidence of the patient's wishes before allowing withdrawal. Missouri was allowed to err on the side of life. The Cruzan family had to go back to court and find old friends who testified that Nancy had explicitly said she wouldn't want to live that way. Once that testimony was heard, the tube was removed. These cases established a hierarchy of decision-making standards that we use today. The gold standard is the subjective standard. Did the patient write it down? An advanced directive or living will is the best evidence. If that doesn't exist, we move to substituted judgment. The surrogate stands in the patient's shoes and says, "I know my mother. She loved independence. She hated machines. Based on her values, she would refuse this." We are reconstructing her voice. If we don't know the patient's values, say a John Doe or a person with severe lifelong cognitive disability, we use the best interest standard. We objectively weigh the burdens of pain against the benefits of life. Best interest is the lowest standard and the most controversial. We cannot discuss this without mentioning Terry Schiavo. This case tore the country apart in 2005. Terry was in a PVS. Her husband, Michael, argued for substituted judgment, that Terry told him she wouldn't want to live that way. Her parents argued she was responsive and wanted to live. It became a war between the spouse and the parents. Legally, the spouse is the next of kin. The courts consistently sided with Michael, but Congress and President Bush intervened, passing extraordinary laws to try to keep her alive. Ultimately, the autopsy proved she had massive, irreversible brain damage. She was blind, and her brain had withered to half its size. The medical facts vindicated the diagnosis, but the political scar remained. The tragedy of Schiavo underscores one major policy lesson. Everyone needs a healthcare proxy, also called a durable power of attorney for healthcare. You need to name the specific person you trust to speak for you. If you name a proxy, that person speaks with your authority, and the state generally cannot intervene. If you don't name a proxy, the state appoints one from a statutory list, usually spouse, then adult children, then parents. If you're estranged from your spouse or parents, that statutory list can be a disaster. The best way to protect your autonomy is to choose your surrogate before you need one. Today, advance directives are legally binding in all 50 states. We also have new tools like pulsed forms, physician orders for life-sustaining treatment, which are medical orders that travel with the patient, translating their wishes into bright neon instructions for paramedics. Do not resuscitate, or do not intubate. The goal of all this policy is to ensure that the patient's voice is heard even when their voice is silenced. To conclude, Lesson 2. We have moved from a world where doctors decided the end of life to a world where families decide, guided by the patient's prior wishes. It is an imperfect system. Families fight. Surrogates sometimes choose based on their own grief rather than the patient's values, but it is the best system we have for honoring the individual. In the next lesson, we will look at a population where prior wishes don't exist. Infants. We will examine the baby doe rules and the ethics of the neonatal intensive care unit.